Hello, everyone. We're going into chapter 28 now, which discusses respiratory care practitioners. These are individuals involved in the evaluation, treatment, and care of patients with breathing disorders. And so, this is one, given the situation that we're currently experiencing in our country with coronavirus, these individuals are definitely on the front lines. They often work with seriously ill patients, those that are struggling with a chronic breathing disorder or one that has become acute because of a condition like the flu or like coronavirus. This is also known as respiratory therapy. And so those terms are used interchangeably in your textbook and on this slideshow. So the work description, as you see there, it describes what a respiratory therapist does, and I'll move myself out of the way here. Um, these individuals can work with a variety of individuals. So it could be infants, it could be the elderly, and it could be everyone in between. They typically focus on specific tests or procedures. Some of you may be familiar with intubation, where we insert the tube into the neck area. Some of you may be familiar with spirometry, where we actually test the ability to expire air. And you'll actually see both of those in the YouTube video link that I've included at the bottom of this presentation. These individuals can work in a variety of settings: hospitals, in-home situations, outpatient settings, hospitals being by far the most common environment for them to be in. This is a 9 to 5 job, but it is not one that is on a Monday through Friday schedule. There's individuals that can work evenings, weekends, nights. These individuals are needed at all times. You never know a situation where you might have a person get in a car accident in the middle of the night and they need to come in and be intubated. These individuals have to be on hand in order for that to happen. Um, Long time standing, moving between room to room. Um, it is possible they could be in more of an office setting if they're in a leadership role. Um, Most likely, though, for this position, they're going to be up and moving, just like you see in the picture, just like you maybe have seen in documentaries or movies. As far as employment, it's growing. This is a group that's seen almost 30,000 jobs added to the employee pool in the last 10 years. As I mentioned, more than likely, these are going to be individuals working in hospitals, and they could work in a variety of departments, a specific respiratory care or pulmonary care area. They could work in anesthesiology. They could work with pulmonary medicine specialist, a variety of potential departments that they'd be in, but more than likely, they're going to end up in a hospital. Um, the last bullet point mentions some potential outpatient settings, some nursing care facilities, as we've talked about in this class. But again, hospitals are the most likely location. As far as education and legal requirements, associate's degree is the minimum, and there are several associate's programs in the United States, almost 400 at this point. Um, there are bachelor's programs for this. Georgia State does have a bachelor's program, and many technical colleges in the United States have some type of respiratory care therapy program. There are master's degrees you can get in this, and we'll talk about why people might do that. Currently, there's 17 programs in Georgia. I mentioned Georgia State, and I mentioned many of the technical colleges. Um, all of the lower 48 states require these individuals to be licensed. Um, all require, almost all employers require that there is some type of certification. These individuals, again, end up in many emergency type situations, so they have to be prepared for some life-saving techniques if necessary. As far as other qualifications, they have to be prepared to work with a variety of individuals. As I mentioned, infants to the elderly. They have to deal with, just everyday situations. They have to deal with emergency situations. They have to be technically skilled. They have to be alert and be able to deal with details. They can't be in situations where The small details are lost. They make mistakes, other things like that. They have to be very capable of working with very complex equipment and equipment that might advance. As far as advancement, this looks just like many other fields that we've seen before. Um, Specialization leads to advancement and more money. Education leads to the potential for supervision, and we've seen that with several other um, lines of work in this particular course. Okay. Again, the bachelor's degree may eventually become more of the standard, and for those that want to be in leadership positions, they more than likely will have to look at a graduate degree as this field progresses. As far as employment trends, we've already seen the growth. If you want a percentage on that, from 2018 to 2028, we're seeing 21% growth, so pretty significant, and even more significant than what we saw in the previous time frame. So this is pretty secure. What also is something to make note of is the fact that this is still an associate's level education, but you can see these people get paid fairly well for someone with only a 2-year degree, and that continues to go up. So about $8,000 added to the average wage, up to about $60,000 now, which we've seen some professions that are master's level that are making $60,000 a year. So the pay is pretty solid for this particular um, for this particular profession. So something to make note of. Um, More than likely, as these individuals continue to get paid more, the level of education is going to continue to go up. All right, so that's it for chapter 28. If you have any questions, refer to your book or this PowerPoint, or send me any messages that you need to. All right, see ya.